Hello, everyone. I'm Mamta Murthi. I'm the World Bank's Vice President for Human Development, and I'm very happy to welcome you to Health Financing in the time of COVID-19 from wherever you're joining around the world. I'm really happy that we can have this very important discussion today. COVID-19 has resulted in a double shock. It's both a health shock and an economic shock. It's caused millions of lives, and it's triggered a huge global economic recession, the largest that the world has seen since the end of World War II. Now, this crisis has plunged more than 100 million people into extreme poverty, and it's increased inequality. The negative impact on human development is well known. In fact, in addition to a health crisis and an economic crisis, it's also a learning crisis. It's a nutrition crisis. It's a crisis for children's health. It's a crisis for women's health. Now, at the World Bank, we've been taking significant action to save lives, to protect the poor, to help countries achieve sustainable growth and rebuild in better ways. In fact, since the start of the pandemic, we have deployed over $150 billion, which is the largest crisis response of the World Bank Group in its history. We also have a $20 billion financing package up to the end of 2022, which is especially designed to help countries purchase vaccines and also set up vaccination systems to deploy these vaccines at scale. The focus of today is the paper that we've launched, which is called Double Shock, Double Recovery, and it was released in March this year. And we argued in this paper that a double recovery was necessary. Countries need to recover not only from the health shock, but also they need to recover from the health shock to emerge from the economic shock, which they have experienced. Now, in this context of the double recovery, health recovery and economic recovery, we want to highlight in today's discussion the latest macroeconomic projections, which portray a very mixed picture for the coming years. Certainly, the global economy is recovering or is set to recover from the pandemic-induced recession. However, there remain very large disparities in the abilities of governments to make necessary the key public investments that are required to emerge from the recovery and build back better. And we're concerned in particular about the ability of governments to make key public investments in health. So today, we're going to explore the implications of these sobering projections with a panel of country experts. And I'm very happy to welcome the distinguished panelists who have agreed to share different country experiences and challenges. We'll hear in the panel from Vietnam, a country that did not enter a recession in 2020, and yet is now dealing with the Delta strain of COVID-19. We'll then turn to Egypt, another country which experienced economic growth in 2020, and it's taken steps to generate additional government revenues and earmark some of these for health. We will also hear from Liberia and Nigeria, two countries that face the prospect of declining government spending. And we will explore with the panelists how their governments plan to finance the investments that are necessary to recover from the pandemic, to strengthen preparedness, and also make progress towards universal health coverage. I'm very happy to say that today's event is being broadcast online in English and in French. You can also follow the conversation on Twitter using the hashtag health financing. So with that, let us get started. And to start us off, we will have a presentation from Krzysztof Kurowski. Krzysztof Kurowski is very well known to many of us. He's not only our global lead on health financing here at the World Bank, he's also the author of the report, Double Shock, Double Recovery. And and leads a large team that is looking at detail into the questions that we will discuss here. So Christoph, let me first turn to you to give us a quick summary of the findings of the report, and then we will bring in the panelists. Over to you, Christoph.
Thank you, Mamta, for the introduction, and thank you all for joining us today. I'm truly delighted to share with you key findings of our most recent analysis. Before that, however, let me step back for a second and highlight some of the key premises of our work on the double shock and double recovery theme. First and foremost, getting over the economic crisis will require resolving the health crisis. And a full recovery from the health crisis will require three things. First, end the pandemic, most importantly through the rollout of COVID-19 vaccines. Second, prevent future health crises through strengthened pandemic preparedness and response. And finally, regain losses in coverage with essential non-COVID-19 health services. Over the next few minutes, I will show you that this health recovery is at risk because of widening rifts in health spending. And to do so, I will briefly highlight some key features of the economic and fiscal outlook, demonstrate some of the consequences for health spending, and then show the implications for the recovery from the health shock. So let's turn to some of the macro fiscal features of the recovery. Here we draw mostly on data from the IMF's World Economic Outlook. You will probably have seen such a figure before. It shows the growth trend of GDP per capita. The good news is the strong return to growth in 2021. On average, across all countries, GDP per capita is expected to grow by 2.1%. 2 points are important, though, to recognize. First, different from the global financial crisis, the Great Lockdown affected all income groups, including low and lower middle income countries. And second, after the deep contraction in 2020, the recovery starts from a low base, and most countries will only reach pre-COVID GDP per capita levels in 2023. This is 2 years from now. This return to growth is critical, but also the ability of countries to build out key public investment. In our analysis, we see large disparities among countries. We use a simple metric. What is the expected per capita general government spending in 2026, the end of the projection period? And by then, will it exceed pre-COVID-19 levels, or will it fall short of them? When we apply this benchmark, we see a group of 126 countries where general government per capita spending will be above pre-COVID levels in 2026. This is a favorable outlook, but not without challenges. For example, despite the general positive trend in spending growth, the lower income countries in this group are expected to go through 1 or 2 years of cuts in general government spending. And then there's a group of 52 countries where general government per capita spending will remain below pre-COVID-19 levels in 2026. In this group, the ability to build out key public investment will be highly constrained. For example, the lower income countries in this group are expected to cut back on general government per capita spending on average in 4 out of the next 5 years. So how will this fiscal outlook impact health spending? We developed various scenarios. Today, I want to focus on 2. Both look at government spending as the most crucial source of health funding. In the first scenario, we analyze how per capita government health spending will develop if governments hold the share of health in their spending constant. You can think of this as the business as usual scenario. The priority given to health in budget decisions does not change, and government spending on health will be driven by the size of the overall government resource envelope. In the second scenario, we assume that the positive pre-pandemic trends in per capita government health spending will continue in the future. We consider this an optimistic scenario. However, it is important to bear in mind that in most lower-income countries, these past trends were insufficient to meet targets for universal health coverage by 2030. The scenario analysis demonstrates how the large disparities in countries' capacity to build out key public investment will likely result in severe rifts in government health spending across countries. Although not without challenges, the outlook for the group of 126 countries with expected growth in general government per capita spending is quite favorable. In contrast, the prospects for the 52 countries with no expected growth are worrisome. Let me explain why, and using low-income countries as the example. In the first scenario, the constant health share of budget scenario shown in blue, per capita government spending on health will drop from $14 in 2019 to $12 in 2026. In the second scenario, the pre-COVID trend scenario shown in orange, per capita government spending will increase from $14 in 2019 to $25 in 2026. In sum, if governments hold the share of spending on health constant, future spending levels will fall far short of pre-COVID trends, with stark gaps between the two scenarios. This, of course, begs the question whether a return to pre-COVID-19 per capita government health spending trends is feasible. In short, for most of the 52 countries, the answer is no. For example, for low-income countries, this means on average doubling the share of government spending going to health, from 10% in 2019 to 20% in 2026. Increases of this magnitude over such short periods of time are unprecedented. In a new piece of analysis, we wanted to better understand what these spending outlooks mean for the ability of lower income countries to finance the rollout of COVID-19 vaccines and the necessary investments to strengthen health security. Let me first turn to the case of the vaccination rollout and illustrate the findings using the example of low-income countries. In the first step, we estimate the growth in government spending on health above and beyond pre-COVID levels. We focus on growth in spending, assuming that pre-COVID spending levels are critical to maintain coverage with essential non-COVID-19 health services. We combine spending growth estimates for 2021 with 2022, as this is the desired period for the rollout. You then compare these projections against estimates for the country's cost share of the COVID-19 vaccine rollout. These estimates reflect the cost above and beyond currently available support from COVAX, as well as vaccine donations. To attain population coverage of 70%, the country-specific cost estimates in low-income countries amount to roughly $4.3 billion. In the constant health share budget scenario shown in blue again, the projected growth in government health spending in 2021 and 22 will cover only 28% of the country's cost share of the vaccination rollout. Please also note the stark differences dependent on the expected growth in general government spending. This outlook does not change much under the optimistic scenario, where countries return to pre-COVID government health spending growth rates. Additionally generated government resources for health will cover only 45% of the country's share of the vaccination rollout. Let me tell you that the forecast for low and middle income countries is very similar. Also here, the growth in government spending will on average cover only a fraction of the country's cost share of the vaccination rollout. Let me now turn to the ability of low income countries to finance investment needed to strengthen health security. In this case, I'll use the example of lower middle income countries. The logic of the analysis is very similar to the one that I just presented. First, we estimate the incremental government spending on health now for 2026. We then compare these estimates with the annual cost of strengthening and maintaining preparedness and response capabilities. We use conservative country cost estimates. On aggregate, they amount to $4.4 billion in 2026. In the constant health share of budget scenario shown again in blue, growth in government spending on health by 2026 will cover only on average 61% of the annual cost of necessary improvements in health security. Also here, this picture does not change much, even if countries make the bold choices necessary to return to pre-COVID growth trends in government spending on health. In conclusion, many lower income countries will be unable to generate from their domestic sources the additional funds necessary to cover their cost share of a vaccination rollout or the costs of strengthening preparedness and response, let alone the costs of both. As shown, steps to return to past growth trends in government health spending are critical, but even then, many countries will struggle to meet the additional spending needs. For them, tough choices will get tougher. Today, we'll hear from the panelists how their countries are addressing some of these challenges. In the worst case, but not unlikely scenario, at least for some countries, progress in the vaccination rollout will be sluggish, improvements in health security insufficient, and progress on the road to UHC stagnant. Such an outcome would pose grave risks to full recovery from the COVID-19 double shock, both health and economic, and not only in these countries, but globally. Therefore, development assistance for health will be critical to bridge the widening health spending rifts. It has been stagnant in the years pre-COVID and may not be easy to boost now at a time when high-income countries are also struggling to maintain their levels of government spending. Yet, high-income countries have a vital interest in reinforcing the global recovery. And by recognizing this interest and backing it with resources, donor countries can help ensure a health recovery for all countries. As the multilateral task force on COVID-19 has stressed, the time for action is now. The course of the pandemic and the health of the world are at stake. And with that, as I highlighted at the beginning of the presentation, also sustain global economic recovery. Again, thanks to all for you for joining us today. And with that, back to you, Mamta.
Thank you, Christoph. I think you have made the point very well that it will be extremely difficult for many countries, especially low income and lower middle income countries, to make progress on all the goals. Recovering from the pandemic by vaccinating everyone, building resilient health systems, and making progress towards universal health coverage. Now, countries are in very different circumstances, and that's why I'm delighted that we have actually assembled a panel which will allow us to hear very different country experiences and draw lessons. Welcome once again to all the panel members. I'm going to place the first question to Dr. Phuong, who's the Vice Director for Health Strategy and Policy at the Ministry of Health in Vietnam. Now, Vietnam is one of the few countries that did not enter into a recession in 2020, and latest macroeconomic forecasts suggest that growth will be strong into the foreseeable future. At the same time, we know from data released by the IMF that government revenues actually fell in 2020, and although they're expected to grow again, they will not climb back to pre-COVID levels until 2022. Dr. Juan, we very much want to hear from you what this decline and then recovery in government spending means for health spending by the government. What happened in 2020, and now what is the outlook for 2021? That's my first question. And my second question is that with the recent upsurge in the Delta strain, do we expect to see a change in the positive macroeconomic outlook? And what would be the implications of this change for health spending? Dr. Phuong, the floor is yours.
Thank you, Madam, for introducing me, and let me have opportunity to join the panel tonight. Yeah, in Vietnam, we have observed, although we have experienced positive growth in GDP in 2020, but there's decline in the government revenue in 2020 compared with the previous year. It's about a 15% reduction in the government revenue, And there's also the increase in the overspending. The overspending in 2020 increased from the it increased from the 2.7% of GDP up to the 5% of GDP in the 2020. Despite of the decrease in the government revenue, we still have the different financing mechanism to respond to finance the COVID response. Currently, my country, Vietnam, has been hit severely by the fourth wave of COVID-19 with the Delta strain, which lastly cause a negative impact in the health crisis as well as the economic crisis in the country. As regard with the health spending, in addition to the regular government budgets for securing the network, the regular network of the healthcare provider at the all level, especially at the at the primary care level. We also during the COVID, we have to spend using the contingency fund, which set up at the 2 to 4% of the government budget at all level of the administrative level. In 2020, we spent up about 18,000 billion Vietnam dong for COVID-19 response, and all of this come from the contingency fund. And in 2021, where we suffer severely from the fourth wave, so there's increase in the spending to finance on the COVID response. So we have up to now the contingency fund has been run out, and now the amount of the 15,000 billion dong, which which is the saving amount from the recurrent expenditure, has been mobilized to supplement for financing the COVID response at the country level. So we can see that at the macro level, there's lastly impacts by the pandemic. However, we have the backup mechanism to finance the on the preparedness and the response to COVID-19 using the contingency fund, reserve finance, and even the national reserve fund to cover on the activities. So up to now, from the Minister of Finance, he still guarantee that there's still the secure resources from the government budget to finance COVID pandemic response in the health sector, including the financial support for the enterprises and household whose lastly impacted by the pandemic. So that is some the figure and the brief on the situation on the health spending in the country. I just want to add more that in addition to the COVID-19 response, it's mainly about the public health and prevention area. There's still the area of providing the curative care for people. And now which is mainly rely on the Social Security Fund, which is now we have the cover of 19 population, 1990 population covered by the social health insurance, and the benefit package of social health insurance cover on the curative care. So now our strategy in the financing that for the maintaining of the health service for the acute and curative care is rely on social health insurance, while the public health and prevention to respond to fight to COVID-19 is rely on the government budget with the contingency fund and the financial reserve. Yeah. Over to you.
Thank you, Dr. Phuong. And you made some very important points about the role of contingency funds and reserve funds to help meet the need for additional resources to fight the pandemic and to support public health functions. I want to now turn us to our second panelist, who is Dr. Mai Farid. She's the Assistant Minister of Finance for Economic Justice and Executive Director of the Economic Justice Institute at the Ministry of Finance in Egypt. So, Ms. Farid, Egypt is another country like Vietnam, which was able to maintain a positive rate of economic growth in 2020. Although government spending fell slightly, it's expected to grow solidly until 2026. It's one of those countries where the forecast is of positive growth in the work of Christoph and others. Although the forecast is for a small decline in 2022. Now, we understand that Egypt has started taking special efforts to raise additional government revenues and earmark some of these revenues for health. And this started even before the pandemic. So could you please tell us about these measures and also why the government of Egypt felt that earmarking was useful and whether this has helped the country meet the current needs to finance the emergency health response? Over to you, Ms. Farid.
Well, first, let me express how honored I am to be here today in the event and to get to speak on Egypt's experience with health financing in the time of COVID-19. First, I would like to start with our latest efforts to raise additional government revenues and raise the efficiency of revenue collection. Egypt, and more specifically at the Ministry of Finance, we embarked on a complete reform for the tax regime. We have been working on re-engineering and automating the tax process to ensure that higher compliance and higher and more efficient collection without increasing the tax burden borne by the citizens. We have increased taxes on cigarettes and tobacco products and brought new tobacco products to the tax base in alignment with the global recommendations, of course. And the new reforms also include reforming the personal income tax regime so that it becomes more progressive and less distortionary. These efforts also come in light of framing the medium-term revenue strategy, which provide the base for revenue mobilization and fiscal space increase. These measures came with the target of raising the tax to GDP ratio by 2 percentage points within 4 years. Additionally, the government of Egypt has focused on developing new innovative methods to raise revenues to be directed to sectors of interest. So in order to benefit for the people at large and to guarantee the sustainability of spending as well. Among these sectors of interest are the education, the social protection, and of course, on top of them, the health as well. These three sectors guarantee the highest return on human capital and thus productivity on the longer run, which makes them of utmost importance to Egypt. A great example of innovative methods to raise revenues and to expand fiscal space to a specific sector was the earmarked revenue. And we have used earmarked taxes and revenues heavily to support the universal health insurance system rollout and towards achieving universal health coverage through a system that's capable of financially sustaining itself. And consistent with the MOF's belief in the efficiency of earmarked revenues, the government earmarked a payroll tax to an account for combating pandemics and natural disasters. It was called the COVID-19 payroll tax, and is simply an entailed of 1% of the net income from all the government's employees and 0.5% of net income from those who are, from pensioners. This latest to the fiscal year of 2021. As such, Egypt is amongst the few countries globally to roll out fiscal consolidation measures proactively to offset crisis spending. However, beyond this spending in time of COVID-19 largely depends on the state budget allocations in support of Ministry of Health and Population as an entity mandated with the combat the pandemics and health crisis. In this, it's worthy to highlight that in response for the COVID-19 double shock was made possible as a result of fiscal and economic measures that the government has taken under the Egyptian Economic Reform Program. This has provided the necessary fiscal space for the government to respond to the effects of COVID-19 adequately and quickly, while maintaining a very favorable growth profile. The government also response to the crisis was designed to be in context of a balanced policy framework, so which was rested on the principle of adopting a balanced approach to strike balance, supporting the economy, but avoiding creating fiscal and debt imbalance as well. This is mainly to support, many more efforts have been happening to support during the time of the COVID-19. Allocations for the health sector, for example, has reached 275 billion, while 17 billion increase compared to the fiscal year 2021. There has been also health spending for the fiscal year 2021 has reached 9.4% of the expenditure, up from 6% for fiscal year 1920. And also, government of Egypt has spent 3 billion Egyptian pounds on acquiring vaccinations since vaccines were made available. And in addition to the payroll tax, government allocated 13.2 billion more in health sector for a period from July 20 to May 21. These are a few efforts of what happened during the period, and I hope give you a better idea of what we have been trying to do. Thank you.
Thank you very much, Ms. Farid. We don't often come across participants from economic justice institutes when we work on healthcare. So to me, your background and your unit is very interesting. I also listened with care about the payroll tax to support pandemic response and the sin tax, as we like to call it, on tobacco to dedicate resources towards healthcare. I think these are interesting experiences that other participants will be interested to hear about. I understand that I'm now going to move on to our next panelist. I understand that His Excellency Samuel Tweah from the Minister of Finance and Development Planning from Liberia is having connection issues. So we are going to turn to His Excellency Ben Akabueze, who is Director General of the Budget Office in the Federation of Nigeria. So welcome to the panel. And my question to you has to do with the growth forecasts for Nigeria, which are not very encouraging and suggest that GDP per capita and government revenue per capita will fall continuously, their projections between now and 2026. The country is also combating an upsurge in COVID-19. So, Mr. Akabueze, we would very much like to hear from you how the macroeconomic situation is affecting the federal government's capacity to address the current health needs of the population and rollout of vaccines, and what are the measures that the federal government is taking. Thank you, and over to you.
Thank you, Marita. And it's my pleasure to be able to join this panel. Thank you, Christophe, for that very informative study. Hopefully, you'll get a copy and look at it in greater detail. But as far as Nigeria is concerned, first of all, I think that some of the projections that Marita reeled out may differ somewhat from what we ourselves are looking at. For instance, for next year, as you know, in 2020, well, we were not as yet as those that avoided recession. We went into recession after 2 consecutive quarters of negative growth in Q2 and Q3 2020. But then, right straight away, a perfect, V-shaped recession, because by Q4 we were back to positive growth territory, and Q1 and Q2 2021 have been positive. Q2 2021, indeed, 5.01 is the highest rate that we have seen in about 6 years. For 2022, we're projecting 4.2%, and our population growth rate is of 2.6%. So if we indeed achieve 4.2% next year, I don't think that is consistent with a projection of per capita, declining. Nevertheless, the per capita incomes are at a level where we know it's lower middle income, but we expect them to come up significantly. Having made these corrections for us in Nigeria, pre-COVID-19, public revenues were already too low. We have one of the lowest revenue or tax to GDP ratio, whichever way you cut it, in the world. And therefore, we had launched in 2018 what we call the Strategic Revenue Growth Initiative. This is at the federal government level, but usually the subnational governments take a cue also from some of what the federal government is doing, to address their own challenges, because the challenge of weak public revenues, government revenues, is nationwide, with the exception of maybe about 3 of the 36 state governments. Most of the others struggle very, badly to, with financial sustainability. So the only way for our revenues to go is up. Unfortunately, COVID-19 created a bump towards, we had part of the goal of the Strategic Revenue Growth Initiative was to move revenue to GDP ratio from a baseline then of 8% to 15% by 2023, which was a very steep goal. We've had now, because of the bump created by COVID-19, to shift that out to 2025 as a new target date to get to the 15%. But even that remains, a stretch. So we're still committed to that process, and it's partly because it's being driven mostly by compliance issues. There's real, massive, tax evasion and whatever. So it's not being driven by new taxes and whatever, or increases in tax, in tax rates. It's mostly compliance that we are, driving. On the other Khanh, healthcare spending pre-COVID was also very low. And I mean, it's not a secret that we have one of the highest out-of-pocket health, expenditure, ratios in the world. And therefore, even without COVID, the commitment was to ramp up healthcare spending. COVID-19, exposed the underbelly of the health sector. I mean, to show that, look, and that's a good thing, that the whole nation is now, I mean, everybody is, is in agreement about the need to step up spending in the healthcare sector. Even those who could afford to, jet out of the country to get, healthcare during COVID-19 lockdown, couldn't go anywhere. So we've all come to terms with the fact that, we need to fix this, the health sector, and that, part of that means stepping up, healthcare spending. And so that commitment remains even, post-COVID. So again, COVID hasn't reduced, spending on the health, on health. Instead, it has spurred higher spending on health, and we expect that to, to remain so over the medium term. The one challenge, though, is that two things. One, on the revenue side, the quest for shoring up revenues by, we operate a federation, a federal system. There's a federal government, there's 36 state governments, there's a federal capital territory, and then there are 774 local governments as a third tier of government, each with constitutionally guaranteed shares of the federation revenue, and each with constitutionally guaranteed taxing, authority. So, but, information, financial information on the other tiers of government, especially the local government, is not readily available. We are currently embarking on an exercise to try and address that. So oftentimes, because it is the financial data of the federal government that is readily available, when people talk about Nigeria's health spending and all of that, it's usually the federal, government's own information that they base all of that on. But in our constitution, healthcare is on what we call the concurrent legislative list. So all these three tiers of government, you'll have to aggregate what they're spending on health to actually then arrive at Nigeria's government spend on health. But I admit that that information is not readily available. We expect that by next year, based on the work that we're doing in the budget office, we will have cured that. But there's now very intense competition for revenue, even among the subnationals, and agitation for alteration of the basis for federation revenue distribution. And the danger here is that the poorer states, which also, as it turns out, generally have the poorest health indices, may lose out in this struggle, and that will mean that their health indices could even head south, further. So that's one challenge going forward. The other thing also is that COVID-19 has generally diverted attention from what people consider to be even more damaging, health challenges here. Malaria is still ravaging, killing far more people than COVID-19 has and possibly could ever, kill. still dealing with other matters like Lassa, fever, and whatever, and basic primary health care. But resources are being diverted now to address COVID-19. The federal government has stepped in to try and shoulder that as much as possible, the burden. So for instance, the cost of COVID-19 vaccines, even delivery, the federal government is shouldering the bulk of of that. But this is a problem. And so there is a debate going on here that perhaps the World Bank and the world at large needs to take a closer look to, interrogate the low, mortality rate associated with COVID-19 in these parts. We've all been in the wait and see mode, okay, from the first wave to second wave to third wave, and but perhaps there's a need to actually maybe focus and look at what exactly is happening in Africa, sub-Saharan Africa, except north of South Africa, and see whether there's really to begin to frame that, and in which case, rather than mandate these countries to do everything that everybody else is doing, even all of the spending on vaccine, and which is diverting very scarce resources from other areas that the people consider more challenging healthcare issues. So I think perhaps I'll close there, but the bottom line is therefore that COVID-19 has unfortunately slowed down progress towards universal health coverage. Not that we were very close to it, but clearly it's slowed down that progress despite the upscaling of expenditure on health. Thank you.
So thank you, Mr. Akabueze. You've said many important things. I particularly appreciated what you said about domestic resource mobilization and the role of tax administration, just better compliance. I think this was a point that our colleague from Egypt made as well. You were also you also talked about the need for better data on overall government spending, particularly in a federal context where health is a concurrent item, and lower levels of government also have revenue raising authority. And I'm very happy to hear the role that your office is playing in trying to pull together better data for policy making. And then you very poignantly made the remark about the inadequacy of resources. And that's how I read your remark about needing to address both COVID and other big sources of mortality and morbidity, like malaria, like Lassa fever, and so on. So you very poignantly made the point that I think Christoph began with, which is that there are very tough choices that are being made because of the challenges to government spending overall, and the need for greater spending on health in order to meet primary healthcare needs, to meet the needs of the COVID response, and of course to achieve universal health coverage. So these are very thought-provoking and useful remarks from you. I'm afraid we have gone over time, and I'm getting all sorts of messages saying we need to move to the final segment, and we will not have a chance for a second round of questions. I just want to assure you that we will be launching this work today, and a couple of you expressed an interest in receiving a copy of the report, and the report and the PowerPoint will be in your inboxes. Please don't worry. And this is a continuing conversation on which we want to continue to engage with all of you. So with that, I would like to move to the final segment of concluding remarks, and these will be provided by our Global Director for Health, Nutrition and Population, Dr. Juan Pablo Uribe. It's a great opportunity for me to welcome you again to the World Bank. Juan Pablo, we're very happy to have you back here. For those of you who don't know Juan Pablo, he has an illustrious career in government, including being a former Minister of Health in his home country, Colombia. He has experience in the private sector, in the public sector, and of course in international organizations like the World Bank. He came back to us just 6 days ago. So 6th day on the job. I'd like to invite you to provide closing remarks to this panel. Over to you, Juan Pablo.
Mamta, thanks. Thanks so much. And thanks for everybody who's participating in the event. We've heard from 3 distinguished speakers representing countries with very different situations. Confronting the same pandemic. In Vietnam and Egypt, as we saw, the economies continue to grow. They're projected to grow throughout 2026. And the overall government spending per capita and the health spending per capita will continue to rise during this period. On the other hand, Ben, thanks so much for the experience and the challenges that you've presented in Nigeria, where, as in other 51 countries, government spending is projected to continue falling and will remain below the pre-COVID levels when we reach 2026. So these are very different situations that countries are facing and confronting. We have heard also clearly that it will be then difficult for some countries to find the funds that are needed domestically within their fiscal space to pay for vaccines, and also extremely important for strengthening the prevention, the preparedness, and the response capabilities that we all need globally for the future. We've seen then that there's a widening rift among these different countries globally. Now, to be very brief, 3 ideas that come from this report on how can we try to close these rifts that had widened. One way is to ensure that all countries can roll out the COVID-19 vaccines and develop these robust crisis prevention, preparedness, and response capabilities. This is core in the mission of us in the World Bank, and we have massively stepped up our support to help countries do so, recognizing as well that additional donor support will be necessary to lay this groundwork for sustainable and resilient recovery on that front. A second way forward is to, of course, and again, our speakers were very clear about it, to focus on the poorest, on those most affected by this crisis, and make sure that we're protecting essential health services, which must continue being available and affordable for them throughout these coming years. A third way has to do with the efficiency in the utilization of these funds made available for health, both domestically and also internationally as well. At the bank, we're working with both finance and health ministries to support this double recovery. I'm confident that together we can advance in it. It's a needed recovery, and we hope that this paper, these discussions, and very important, the experience and the efforts from the different countries being shared will help us advance and succeed in this double recovery.
Thank you. Thank you very much, Juan Pablo. So with that, we are going to conclude. I want to thank once again our distinguished panelists for participating and sharing the experience of the countries that they come from. I want to thank the health team under Christoph's leadership for this very good piece of work. We're putting it out today, and we hope that this can help influence the discussions going forward on what is needed to support this double recovery. And I also want to thank all the participants and those who are listening to us live. We've had many of the people in Christoph's team actually engage in a live chat in multiple languages, responding to people's questions. And we hope this has also helped in carrying forward the messages from the report. So with that, there's nothing further for me to do than to say thank you all once again. And I'm looking forward to continuing this conversation with everybody. Thank you and bye-bye.
Thank you. Bye-bye.